All right, everyone, welcome. Thank you for joining us for yet another important town hall and an important opportunity to cover several topics. As we always do when we begin these sessions, I will start with the land acknowledgement from where I'm coming to you today, which again is from Ottawa. So I am on the traditional territories of the St. Lawrence Iroquois, the Anishinaabe, the Mohawk, and the Algonquin peoples. And recognizing traditional territories in this way, as we do at all of our meetings, is a formal expression of appreciation from Canadian Blood Services for the Indigenous peoples and cultures across the country and on whose lands we live, work, and play. I want to start today's town hall very briefly with I guess, in some ways, a sad note and an acknowledgement of an important loss relevant to Canadian Blood Services. I think some of you may have seen in the news recently that Justice Horace Creever, who we all know as the individual who led and authored the Commission of Inquiry on the Blood System in Canada in 1997, Justice Creever died earlier this week at the age of 93 or 94. And I think for many of you, you will know and appreciate that his findings from his report, his 1,000-page report and his 50 recommendations, really were the foundation for Canadian Blood Services. The entire organization and the blood system around CBS was built on Justice Creever's recommendations. And as I have said many, many times over my career here, not only did Justice Creever influence the blood system in Canada, he actually developed a blueprint for blood systems around the world, and he has left an indelible mark on how blood systems need to operate in order to make the right decisions and protect the trust and confidence of societies and the public in our organization. So for me, it's an important acknowledgement of his loss. I think he helped shape who we are. And I guess my ask of all of you, all of us, is that we continue to live Justice Creever's legacy through the work that we do every day. And I know that what you do matters and what we do matters because Justice Creever provided a great blueprint for us. So I thought I would start with that important acknowledgement. Let me briefly mention something that's also been topical for many, and no doubt many of you are involved in supporting this. We've had a period for a couple of weeks now, more than a few weeks, where we've had some inventory and collection challenges, particularly around group O negative and B negative groups. But even if I look at the macro numbers now, the inventory opening amount at the beginning of this week, May the 8th, was around 15,000 units of red cells in inventory. That's quite below our lower threshold, which is 18,000 in inventory, and significantly below what we call our optimal range, which is about 21 to 25,000 units of red cells. So we're in a bit of a pickle, if you want, and it's, as I say, focused to a larger extent on the two blood groups, B negative and O neg. There is some explanation for that. B neg is a group that this very small percent of the population is B negative, therefore a small percentage of our donor base is B negative. But it is a group that has particularly high demand for some patients, for example, sickle cell disease patients who often get multiple transfusions with high frequency. So we've had a little bit of a run on demand there. And we've also known that some hospitals have been switching when they don't have enough B negative, they're switching to O negative for those patients. So that's put a downward pressure on O neg. Anyhow, I share that with you all because here we are again in a situation where we need to get our inventory up back to our preferred optimal range. There's a significant focus underway now with the marketing groups and the donor recruitment groups to really achieve a sustained increase in our collections. And really what we are driving for is to increase our collections by 3% above target for every single week between now and Canada Day, so about 6 or 7 weeks from now, in order to get us back to close to that optimal range. So that's a significant lift that we have to do. We also have an important campaign starting in a couple of weeks, I think next week sometime, called the Shine a Light campaign, which is a major campaign that we launch at this time of the year as we approach National Blood Donor Week. So between the campaign Shine a Light and the extra efforts by the marketing and recruitment teams, we have some work to do, but I'm confident that we'll get the inventory levels back to where they need to be. Briefly, an update on plasma. I know this is a topic that many of you follow, and I think some of you will know that just in the last couple of weeks, we opened another plasma donation center, this time in Abbotsford, British Columbia. And within the next few days, probably early next week sometime, we'll be opening yet another center in Vaughan, Ontario. So that will bring us to a total of 7 when you add Abbotsford and Vaughan to the other 5 that are already operating. And sometime later this spring, not too many weeks away from now, we'll be opening number 8 in St. Catharines, Ontario. So by the summer of this year, we will have 8 of our planned 11 plasma donor centers operating, with the remaining 3 to open sometime in early to mid 2024, bringing us to our committed number of 11 sites. This is important work because, as you all know, and I've talked to you many times before, the global challenges with immunoglobulin supply persist to this day. It is a product that is in high demand around the world, high demand in Canada, global shortage of sufficient plasma to make immunoglobulin. And so this is all part of our commitment to helping achieve a greater amount of domestic security of supply and immunoglobulin sufficiency. So thanks to all of you on the plasma teams, supported by the many, many other teams in facilities, IT, legal, all other groups in the organization. I also want to acknowledge we opened another center recently in Scarborough, Ontario. This is not a plasma center, this is a multi-product center. We'll be collecting blood, plasma and platelets in Scarborough. It opens next week. I think it's the 16th of May, if I'm correct. It's going to be another one of our important new centers, an important market we want to be in. And I want to thank all the folk who have brought the Scarborough Center to life, and look forward to that taking off and serving that community there. And then let me switch to one more topic before I introduce my colleagues. I know I've got a little bit of a longer introduction today than normal. This topic is obviously an important one. You would have seen an announcement. Some of you might have seen an announcement come out, and there will be another email following this town hall. And this is really about the so-called hybrid work environment, or bringing people back into a Canadian Blood Services environment for greater in-person connection. So this is something that we, and pretty much every other organization around the world, has been evolving since the pandemic. And of course, as we know, many of us left the office space and went to work from our home environments. And again, I have said this dozens of times before, but I will say it again. I know when I raise this topic, we are only talking to those of us who have been able to work remotely during the pandemic. And of course, for all of our colleagues who have shown up on the front line every single day throughout the pandemic, whether it's for collection, production, testing, distribution, or any other functions that were necessary to keep going in the pandemic. This topic obviously doesn't apply to you, but it does apply to all individuals who've had the opportunity to work remotely. What we are trying to do here is achieve an important balance. I've talked about this before, a balance between ensuring an employee experience where connection and collaboration and the culture of Canadian Blood Services are very important. And how do we achieve that connection and collaboration, balanced with the flexibility that employees want in a work environment going forward? So guided by this and guided by a lot of research and best practices and a lot of extensive analysis how best to do this, as you all know, many months ago, we asked people leaders to begin to model a behavior by being in a Canadian Blood Services site 40% of their time. And we're now going to be extending that to all employees starting July. So what do I mean specifically by that? Come July and progressing from there onwards, 40% of an individual's time will be in person at some Canadian Blood Services site or some site that is linked to the work we do. It could be at a hospital, it could be at a conference you go to, it could be some professional development activity, whatever it is, as part of your work. 40% of your time will be spent in person with others in a collaborative, connected way. This is obviously a significant change for many. We know that lifestyles have adapted for many during the pandemic, and you've made choices at home with family members and caregiving and lots of other commitments that people have in these lives. We also recognize that for some individuals, there will be specific meaningful reasons for which exemptions to an in-person presence, 40% of your time, could be granted. And we're going to put in place a very specific process to guide and manage those exemptions, and we'll be providing lots of information about that. Your PCP business partners will be helping us navigate all of this, and all of these exemptions will be evaluated on a case-by-case basis. I'm mentioning this now. I mentioned our start date in July. We have some time still to do a lot of work here. And I guess I also just want to sort of say this, and I know a lot of this will come up in questions and my colleagues will help me address in a few minutes. This is going to be a little bit of a bumpy road. We know that this is going to It's a big change for many. It won't go absolutely perfectly and smoothly up front. We absolutely are acknowledging that, but we want your feedback. We want to hear from you how we can make this work as well as possible. We want you to help us design a hybrid work environment, an in-person presence, 40% of your time, that is optimal, that is positive, that is linked to the work we do at Canadian Blood Services, that helps our brand and our mission and our purpose. And we certainly want to hear from you. So you will see in the chat for this meeting, we've created a specific feedback form. I think that's gone into your chat now. So if you haven't seen it, please just link on the chat and you will find the link there so you can then give us your feedback as this unfolds. Let me stop there because I no doubt there'll be a lot of questions on return to a hybrid environment. At this point, I want to introduce my colleagues. I've done a lot of talking. So today I have two colleagues joining me on the town hall. Jennifer Camelon, our CFO and VP Corporate Services. Jennifer's been on some town halls before, so she's a pro at it now. And also joining us is Richard Smith. Richard is, of course, the newest member of our executive team and our Chief Information Officer. Many of you know Richard, and I think all of you depend on Richard's guidance and the work that he does, but some of you may not know him. So Richard, I'm going to ask you, firstly, welcome you to your first town hall and ask you to introduce yourself briefly, and then we'll go back to you, Sheila, and get started with the questions. Richard.
So thank you for that, Graham, and folks, thank you for the opportunity to actually talk to you today. As Graham said, most of you know that I'm the Chief Information Officer and the one person who's always constantly thinking about technology and how we drive value to the organization. It hasn't been just about a year since I've been with CBS, and I can tell you I'm very encouraged by the resiliency of the organization to organize and to actually tackle both big and small challenges, but most importantly, to do so by pursuing emerging opportunities. I'm very even excited to give you just a little bit of a scorecard, if you allow me to let you know of some of the important work that we've been doing here with CBS, the technology team, IT team. Many of you may already know that we continue to strengthen our cybersecurity posture. We continue to ensure that we have tools and resources to always assess and evaluate the threats that exist in the world of cybersecurity. We are constantly working to build resiliency when it comes to our infrastructure, both for mobile, wired, wireless across the organization. We're kicking off a project to improve the infrastructure across many of the sites and to give you a better experience as you interact with our technology. Our digital platforms, both for the donors and for hospital partners, is evolving. In fact, today, 80% of most of the orders are filled through the online portal, and just about 51% of all bookings are done through the mobile app. So that's a huge accomplishment for the organization, and we hope to see better results in the coming months. And I also wanted to let you know that we are in the process of building a center of excellence for data and analytics, so we can make data readily available to everyone across the organization to know how we are performing, and then to use that information to make decisions. So on behalf of myself, the IT team, I want to say thank you to all the employees who every day come in and are very vigilant in terms of how you help us to fight against cyber breaches and cybersecurity, and to the leadership team for all of the investments that you're making in IT so that we could continue to provide good quality products and better experience for all the staff. So thank you so much, and I'm really excited to be here. Back over to you, Greg.
Thanks, Richard. Thank you very much for that. And I'm sure there'll be a lot of questions to probe in some of those a bit more deeply. For those of you who don't know, Richard comes with a deep experience from both the healthcare sector and the education sector, working in large, complex environments. So we're thrilled to have you as our leader here, and thrilled with the team that you've got around you with great individuals and great wisdom. So Richard, thanks for that. All right, Sheila, let's get underway with the first question.
Sounds good. The first question comes from Josh. I recently heard from Graham's most recent blog that we are looking at using artificial intelligence. Could you possibly share how that's going and what ways we plan on using AI?
Well, thanks, Josh, for reading the blog. I'm glad to know that it gets an audience. That's excellent. I'm going to make a 1-second comment and let Richard give a couple of examples. This whole notion of the application, usability, relevance of artificial intelligence to our business at Canadian Blood Services is something obviously that we're paying attention to, but not just Canadian Blood Services, all of our ABO partners in the Alliance of Blood Operators. This is very top of mind for all of us, and we're actually comparing notes with each other how AI can, should, may, or might improve or disrupt our business, and it's something that is really relevant on our agenda. Richard, maybe you can pick up a couple of examples where we're either using or contemplating to use AI to improve our business.
Yeah, so thanks, Graham. In most regard, AI is not relatively new to CBS. In fact, if you think about Microsoft Office 365, which we all use, there is a feature of AI in that. We have done some work related to donors event and weather forecast where AI is actually built into that. But that's just us kind of kicking the tire, dipping our toes in the water somewhat. There are tremendous opportunities for where AI can be used in data and analytics. Some organizations have used AI related to corporate, providing corporate response to staff, whether it's in HR or even in benefits and so forth. Organizations have used AI, or some organizations are starting to use AI in medication management. So if you think about some of our donors that has medication, they can use AI to figure out part of that process and part of the DSCM field is supply chain. Again, there's opportunities there. I want to say that there is a lot of chatter around AI and how it's going to evolve over the next few months and years, and we're mindful of that. We're constantly trying to figure out where is the best use cases for AI, but we have to balance that with some of the, what I would say, known and unknown risks that it does present. So stay tuned. There is more work that we need to do in terms of how we craft where AI would best serve the organization. But I think it's really exciting time for how we'll be able to use this piece of technology to provide value to the organization.
Thanks, Richard. Maybe we can do a blog at some point, you and I, on some of these opportunities. Sheila, back to you.
Thank you. Question 2 comes from Mary. I wanted to follow up on the important issue of period poverty and having a supply of period products available for staff, volunteers, donors. Has there been a decision made on whether these products will be made available at Canadian Blood Services? This is an important equity issue.
Maybe I'll just take a quick one at that. The short answer, firstly, Mary, thank you for raising that and thank you for bringing the issue back. We had this on a town hall quite a few months ago. The very short answer is yes. We know that period equity is important. We know that many organizations have been seeking to provide these products universally available for, and in our case, that would apply to employees, volunteers, donors, visitors to our centres, anyone who's in a Canadian Blood Services site or facility. So yes, we've made the decision that we're going to do that. And our DEI team is working with our corporate services team to sort of get all the steps put in place. I don't have a specific timeline of when that will be, but the short answer is yes, a decision's been made, and yes, we will be seeking to address, as you call it, period poverty or menstrual equity, so that all of these hygiene products will be available in all of our sites to anyone who may enter a Canadian Blood Services site, including mobiles as well. So a little bit of detail in the implementation, but the short answer is yes. Sheila.
Thank you. Question 3 is a frequently asked. I understand that we are going to be removing the acrylic barriers that were installed for COVID. Some of us would prefer they stay up. How do we make this request?
So again, maybe I'll take that one briefly. There's two important points I want to make. So firstly, the barriers that we installed early on in the pandemic were, by their nature, immediate responses to the concern around transmission of the SARS-CoV-2 virus. They were temporary in nature. They were never designed for a long-term purpose. And they served an important function at a time when there was still perhaps a lack of understanding around transmissibility of the virus and whether these barriers would actually help reduce that transmission. And you saw them pop up all over the world and in all of our daily interactions at grocery stores, on transit, and at Canadian Blood Services sites. Many years later now, with the high vaccination rates that we have and the low disease burden that we have, we, like most other organizations, have made the decision to remove those temporary barriers. They're no longer serving the purpose now. And if we need to consider establishing other barriers on a permanent basis for a broader set of reasons, for example, to prevent employees or volunteers from donors who may be acting inappropriately, that's a whole different set of decisions we're going to have to go through. But the temporary barriers that we have in place now really don't serve that purpose, won't serve that purpose. And so we are removing those. And I think the removal of them has already started across CBS sites. So we'll revisit if it needs to come back for another reason. Sheila.
Thank you. Question 4 was submitted anonymously. Shortly after getting media attention in support of organ and tissue donation, i.e. Green Shirt Day, there has been media coverage about restrictions to eligibility for MSM donors. Is there any information you can share in regard to that topic?
Sure, I'll be brief, and I'm sure we'll get to other questions that Jennifer and Richard can pile in on, but I'll take this one. So if you've been following this, it's been in the clippings on a daily basis. It's been fairly widely reported in the news recently. There was an individual who had sort of stipulated his wishes to be a tissue donor. This individual self-identified as a gay man, and unfortunately, the system did not permit his tissues to be harvested after his death. He was deemed ineligible as a tissue donor. I want to be clear, although we, Canadian Blood Services, have taken a very specific lead role in evolving what we used to have as our so-called MSM, men who have sex with men, deferral criterion for blood and plasma donors, and is now evolved to our sexual behavior-based screening program for all of our donors. That is a policy and an environment where we own and operate the system. So we are responsible for blood and plasma donors, and we are responsible for setting the policies around that. And that is why we evolved that policy. The organ donation and tissue donation environment is much more complex. We do not have responsibility for the recruitment of those donors. We don't have the responsibility for the screening of those donors. There is a different set of regulatory standards compared to the blood standards that we operate under. And so the change there is not something that we can directly control and influence. We can certainly provide input to and support for the transplant community, but it's really up to those who are responsible for the recruitment and ultimately screening of would-be organ and tissue donors to make those changes. So we certainly understand this issue well. That goes without saying. I would go so far as to say it makes sense to me that those policies should evolve, similar to the blood policy and the one we use for our blood and plasma donors. And we will be collaborating with the communities to help evolve that, but it's not something we at CBS control or can direct ourselves, given the way those recruitment activities work. Sheila.
Thank you. Question number 5 was also submitted anonymously. What is the expected benefit of having all groups return to the office 40% of the time? There are definitely teams that don't need direct contact with one another, not to mention the frustration of using and arranging a new workspace with every visit to the site. It certainly isn't an efficient way to organize a day or week.
Look, any of us could answer that. Jennifer, do you want to maybe offer some of your thoughts? It's a good question, and it covers a number of the issues that we've tackled here.
Sure, thanks. Thanks, Graham. You know, absolutely for sure. We know there's a whole variety of conditions across the organization. The major benefit that we see is the connection, the opportunity for connection and collaboration, both with one's own team, but with other teams. Each one of us is supporting the front line in terms of supporting Canadian patients with very important products and services. And really having that grounding of working together in a collaborative fashion is very important. So in bringing teams back, what we're hoping that the teams are going to focus on is what uniquely can be done better at our sites, and investing our time and planning our time to make sure that we get that value out of being together, both in terms of service to our mission, but also in service to each other. And the benefit of community that we have across CBS of a wonderful team as we all collectively recover from the pandemic in a very difficult time. So advice from my side would be focus on on what we can uniquely benefit in our workspace, and we'll work to support everyone to have the space be as productive and functional as possible.
If I can maybe just reinforce that last point that Jennifer made, I certainly agree with her sort of perspective of how we need to look at the benefit of this. Our teams, whether it's the facilities team under Jennifer, the IT team under Richard, many other teams are going to be there to support all of us to make this as efficient and effective as possible. It's going to be a little bumpy as we get this underway, but there's a lot of planning underway now. We're going to try to make it as seamless as possible, but that's why in my opening remarks, I really urge you to use the feedback form that is in the chat. Use it to share your ideas with us. We want to sort of build all your ideas and thoughts into how we can make this work as best as possible. But I do think the upside at the end of the day is really what we are striving for here. And I'm sure maybe there'll be other questions where we can speak to some of that in more detail. Sheila.
Question 6 was submitted anonymously. What are your thoughts on TikTok, and should we be using it on our phones?
Richard, if I knew anything about TikTok, I might answer that question, but I'm going to ask you to speak to that one.
So, you know, there was a lot of conversation in the news today about TikTok, and especially around government organization in the US and in Canada. And at CBS, we use TikTok to communicate with a certain, if you want to say, population. If you can really truly appreciate the way we reach donors is entirely different from one group to a different. We have seen no known issues that will require us to change the strategy today as it relates to TikTok, but we continue to monitor what's happening. And as soon as we know we have different information that would allow us to make different decisions, we certainly will do so. But TikTok is embedded as one of the tools that we use to reach donors through our campaign.
Thanks, Richard. Sheila.
This question comes from Aldous. I was just reading an article about the developments in lab-grown blood, and I was thinking it might be interesting to hear Graham's thoughts on this. What are your thoughts on lab-grown blood, and what could it mean for the blood system?
Thank you, Aldous. I'll be brief because I could talk a long time in this one, but I won't. I've been around this industry a very long time. And I can tell you the research into so-called synthetic or artificial blood goes back decades. In fact, goes back 70 years or more. The first real research program began by the US military at the time of the Korean War. So we're talking 70, 75 years ago. And there's been endless amounts of research to try to find ways of making either artificial or synthetic red cells to replace the need for human donors and the product that we collect from donors and provide to patients. More recently as in the last 5 or 10 years, maybe, as the science has evolved and we've had the ability to grow cells in the laboratory, you can grow stem cells, you can grow you even see research about growing artificial organs and all sorts of things. There is a body of research now. Can we actually grow red cells from primitive cells in a laboratory environment to essentially mass produce large volumes of red cells that could then be used to transfuse to patients? This science is in its infancy. There is a very, very, very long road ahead, I suspect, to do the necessary development work, the clinical trials to prove safety and efficacy. The 75-year journey that I described a minute ago, it's littered with hundreds of important clinical trials, all of which have failed to show benefit of the product, synthetically grown or synthetically developed, compared to the efficacy of human red cells that we produce from our manufacturing environment. So I'm not saying that it won't ever happen. I think this is an exciting scientific development we need to stay on top of. But I can say with a very high degree of confidence, we're not going to be put out of business in the next 5 or 10 years. We're still going to rely on donors, and patients in Canada and around the world are going to rely on organizations like us to collect, test, produce product safely so it's available for them. But it is important science, and it's science we'll continue to monitor for sure. Gina.
Question number 8 was submitted anonymously. I'm wondering, since the rebranding, has the percentage gone up regarding the public knowing about Canadian Blood Services, whereas they thought Red Cross was still the blood donation collector?
Let me, sure, I'll take that one briefly. And it's a very timely question, actually, because it's almost the 5th anniversary since our brand relaunch. You will remember that our brand relaunch was in September of 2018. So come this September, it'll be 5 years. And one amongst many, but one of the important elements we were looking to achieve with our brand renewal was to increase awareness of Canadian Blood Services and reduce confusion in the marketplace between Canadian Blood Services and our predecessor organization, the Canadian Red Cross Society, that, of course, as we all know, ran the blood system in Canada from the Second World War until 1998. So this was one of the important areas that we wanted to assess, and using our contracted research firm Ipsos, they've been polling the Canadian public quarterly, every single year quarterly, actually since our inception, but also since 2018 when the brand relaunch happened. And the data shows very clearly that we've had significant improvement in awareness of Canadian Blood Services and in reducing confusion between Canadian Blood Services and the Canadian Red Cross Society. At its very peak and that sort of height of the pandemic, when there was a lot of media attention to the need for blood donation, we had about a 25% greater public awareness for Canadian Blood Services compared to Red Cross, which was certainly the highest we've ever seen. But for the last few years, we've operated at about a 10% lift above Red Cross, whereas in prior periods, actually fewer people knew Canadian Blood Services, and most thought Red Cross still ran the blood system. There is still work to do when it comes to brand awareness for our work in organ donation and transplantation, stem cells and plasma. It mostly hinges around blood, so we know we've got more work to do. But the short answer to your question is the brand renewal more than achieved a significant benefit in this particular area, as it did in many others as well. Sheila.
Question number 9 was also anonymous. If my city has multiple CBS locations, can I book space and work out of any location, even if different from my pre-COVID location?
Short answer is yes. And this is something you will work with your managers. We're not going to be directive. We are going to be providing guidance for sites, but managers and teams will be able to make some of these decisions. Jennifer, do you want to perhaps pick this one up and sort of talk about how we see some of these choices being made as we roll this out after July?
Sure, absolutely. So we are taking sort of a look at our, sorry. Yes, absolutely, Graham. We're looking at the sites across the country to understand sort of the team dynamics, or the, you know, the number of team members in each region and what's going to work best in each region. So we absolutely will be able to accommodate people at different sites. As Graham said, coordinating with the manager will be important. Depending on the site, we may be using our booking tool Condeco in some sites and not in others, based on if we are over capacity or not at a various site. We have had quite a few changes through the pandemic. We've hired over 400 people who have been working remotely or during that time, who now will be working to basically bring back to various sites across the country. So absolutely work to provide solutions for the teams and hopefully a fair bit of flexibility as we work together to increase our in-person presence.
Thanks, Jennifer. Sheila?
Question 10. Has Canadian Blood Services experienced a cyber attack in the past? And if one should occur, would you let employees know?
Mr. Smith.
There are always attempts for external organizations to try to penetrate most organizations, and I'm being a little bit vague on purpose because we recognize that the information we put out sometimes can get into spaces that we don't want it to be, and we do not want to trigger any attempt by external actors to at least try and see how our systems are built and how resilient it is. But nevertheless, we have internal processes that we look at, and yes, if there is a cybersecurity breach at Canada Blood Services, bet your life you will know, because obviously, depending on the nature of it, we'll be calling on you, the end users and staff and across the organizations, to help us to recover. So absolutely, you will be informed.
Thanks, Richard. Sheila.
Thank you. Question 11 is a frequently asked one. Are there exemptions for the new hybrid policy? Will those hired remotely be expected to come in 40% of the time?
Let me offer a brief answer, and again, Jennifer, if you want to expand, please do. So the short answer is yes. I mentioned this in my opening remarks. Exemptions will be considered on a case-by-case basis. We are putting out guidelines for exemptions. Every case will be evaluated as it's brought forward. You cannot assume right up front that you're exempt. If you believe you have a reason to be exempt, either the conditions under which you were hired or for a particular health condition or whatever, requests need to be submitted, and it's all in the information, hybrid.requests@blood.ca. They need to be submitted in the next few weeks. It's all going to be provided in the guidance, which is coming out today or came out yesterday already. And again, exemptions will be evaluated. Your PCP business partners are there to help people work through those, and each case will be looked at on a case-by-case basis, so we can make a set of decisions that are fair and equitable, and all exemptions are treated in a similar way. So we're not sort of making these decisions randomly, and we're not leaving managers adrift at making these decisions without very clear guidance. So short answer is yes, there will be the opportunity for exemptions, but each case will have to be evaluated on its specific merits. Jennifer, I don't know if there's anything to add there.
No, I think you covered it quite comprehensively, Graham.
Thanks. Sheila.
Question 12 was anonymous as well. Will our public staff washrooms in our fixed donor centers be changed to be gender neutral, not with just signage, but updated to be more inclusive?
Jennifer, how current are you on our work on the gender neutral washrooms?
Yeah, so I think as we have new projects or renovations ongoing, it certainly is taken into consideration. So we are working through a multi-year master plan for our facilities and looking at various elements such as this as we do upgrade or build new facilities. So if there is a specific question around a specific site, please feel free to email facilities@blood.ca, and we'll see if we can get you an answer.
Thanks, Jennifer. Sheila.
Question 13. Today, we are asking employees to come into the office 40% per week. Will this eventually turn into 100% in the future? I think it's important that EMT is as transparent as possible.
Very important question. And let me say that I certainly agree with the last sentiment there. It is important we are transparent in our intention, transparent in the timelines, transparent in the objective we're trying to achieve. And I can tell you that with absolute certainty for now, our target is to create a positive, effective, and vibrant hybrid environment that has people in a Canadian Blood Services site or working environment 40% of the time. That is what we are working towards now. It's going to take a while to evolve to that. It's going to take a while to measure the effectiveness of that. I don't know what the end state is. I do suspect, and I think most people around the world would say, the end state is a hybrid work environment. It is a flexible hybrid work environment that allows organizations to achieve the balance between connection and collaboration on the one hand and the employee desire for flexibility on the other. So I think the world of hybrid work is our future. Is 40% the target forever and a day? I don't know. It seems to be a very prudent one for now, and one that works for Canadian Blood Services as a biologics manufacturer that depends on the power of connection and collaboration for its workforce. So we believe that that's the right target for now. I don't believe there is any evidence that the work environment is going to revert to 100% in office for all employees permanently, as might have been the case pre-pandemic. I think the world has evolved dramatically, but I honestly have no evidence on which to say, will things change beyond 40%? And should the evidence emerge in time and should we change it, I assure you we will be transparent and share that information and our rationale with ample timelines. But for now, we are working towards an environment of 40% in Canadian Blood Services sites for all employees. Again, recognizing our frontline team members who have been here 100% of the time right through the pandemic. Sheila.
Thank you. Question 14 is frequently asked. Is there any discussions at the executive level regarding a 4-day work week at Canadian Blood Services?
Very little is the answer. We've had some, and this question has come up before, and I know Andrew Pateman has spoken to it before. We've occasionally sort of contemplated, is this a feasible environment for us at CBS? And again, I want to remind us that the work we do is 365, 7 days a week. You know, the collection, well, we don't collect 7 days a week, but we are distributing product 7 days a week. We are manufacturing it 6 days a week and so on. So I think it's really important for us to reflect who we are as an organization, the purpose that we serve. Now, could it be that a part of our administrative workforce could work 4 days a week and not 5 and still support the organization? It is possible. It's just not something that has been high on our agenda now and doesn't have a whole lot of analysis or assessment, but it is certainly one of those questions of, you know, what is the work of the environment? What is the workplace and the work environment of the future? It's one that we know we will need to look at and make a decision whether it's going to work in our environment or not. Sheila.
Question 15 was also frequently asked. Will there be disciplinary action if employees refuse to come in for 40% of their time?
So I'll take this, and again, Jennifer or Richard, please feel free to add. You know, I would like to think that as an organization, when we establish guidances, when we have policies, when we have practices as a condition of employment, that individuals who choose to work at this organization choose to comply with the work environment that we have. We also always have in all of our policies, in all of our guidance documents, conditions to consider if individuals choose knowingly not to comply with the condition of employment and don't have a reason to be exempt from it. So you could say that's a little bit of code speak in my answer. Yes, there will be disciplinary measures considered if individuals choose knowingly to not comply with the decision that we've now made that applies to all employees and don't have grounds on which to be exempted. So again, these will be evaluated on a case-by-case basis, but our standard approach to discipline up to and including termination, which is part of our the way we look at these things, will be considered. But I think Jennifer has said it before, and I'm going to ask her to reinforce it because I find it so powerful. We have to look at the positive. We have to look at the benefit we're trying to gain here. And maybe, Jennifer, I know you say it so well and with such conviction, so maybe you can come back at why are we trying to do what we're doing here?
Yeah, I mean, I think it's just there is an opportunity to do certain things. Sorry, I apologize, waiting for the mic. There is an opportunity for us to do certain things really well in person. And I think if we can all sort of lean into what that opportunity is around creating connections, getting to know people. We have a ton of new employees in the organization. That's where there's huge value for us. So as challenging, and it is change for everybody, for the people that are affected, as much as it is, if we can look for the what benefits we can get out of it, I think, it will help with the transition. I do think, Graham, we are committed as well to reasonable flexibility for people. That type of language is for, I would call, probably a fairly unusual type of case, because, we do have a spirit of flexibility, I think, that CBS has, sponsored over the years.
Agreed. Thanks for that, Jennifer. Sheila.
Question 16 was also submitted anonymously. With the return of staff to the office, are there plans to upgrade the quality of the Wi-Fi at various locations so that staff are able to function efficiently? Some of the sites had upgrades last year. However, the quality of the Wi-Fi has not improved whatsoever.
Richard.
So initially, yes, the answer to that is yes. We do have an assessment, a comprehensive assessment taking place probably within the next few months to evaluate both wired and wireless across all sites. And the goal is to actually upgrade the Wi-Fi across the organization. So that's yes.
Jennifer?
Great. Super, thank you. I think I would stress for everybody that we are increasing our investment across the national footprint of facilities and our IT infrastructure. So we have this past year increased our investment. We have approved for additional investment, and we are planning for continued investment. So a number of those items that really impact everybody's quality of life on a day-to-day basis, be it wireless, the cubicles, the gender neutral washrooms, as we raised. We're aware and we are investing. It will take some time. We have a lot of sites and we have supply chain lead times, but just want to make sure that everyone is aware that EMT is fully behind and prioritizing making sure we have good infrastructure to support our operations and our teams.
Great, thank you. Sheila.
Question 17. I've noticed that there have been several leaders with long tenures at Canadian Blood Services who have recently retired or soon will be. Are there steps Canadian Blood Services is taking toward leadership succession planning?
I'm going to take that as the one amongst the three who has the longest tenure by far on this call. And you'll hear my closing remarks in a moment. Will play into this question as well. So thank you very much for asking that question. It's an important one. And you are indeed correct. There are a number of us at the executive team, myself included, who have been here a fairly, in some cases, a very long time, since inception in my case. And it is a very important phenomenon. So I can tell you that I, with the responsibility for the executive management team and the board, as my employer, take the issue of executive succession planning very seriously. This is something that I have to discuss with the Talent Management Committee at least once every single year. So I work with Andrew Pateman, and he and I take an extensive discussion to the Talent Management Committee of the board, which is the board committee that oversees human capital or talent issues at Canadian Blood Services. And the whole idea of executive succession planning is very important. It's very carefully thought about. And I work with my team to make sure that when those of us who are going to choose to retire, we don't all do it at a sort of a similar time period, and we don't create risk in the organization. So short answer is yes, the demographic is obvious. The question speaks to that. There's a number of us who are similar in age and who've had similar tenure in the organization. And I do pay very careful attention to this and seek to manage it in a way that makes sure there is succession, there is renewal of the team. I mean, Jennifer and Richard are two perfect examples, both within the last year, in Jennifer's case, just over a year, and bringing incredible new skills, capabilities, experiences, and ways of thinking into the organization. And so succession planning and renewal is as important for bringing new thought leadership in as it is for ensuring you don't create a vacuum when those of us who've been around for a while choose to hang up our shingle. So yes, very important issue. Sheila.
Thank you. Question 18 was anonymous. Will IT and/or Richard be looking at updating our technology to keep up with the times? My laptop is old and the battery doesn't last very long.
Short answer is yes. And if you have a laptop that is extremely old, and you can just reach out to IT and we'll make sure that we replace it for you. We do have a 5-year renewal cycle or 5-year renewal plan, which we work with finance to make sure that now all of our technologies are scheduled for renewal. So we absolutely would be refreshing the technology across the organization.
So maybe, Petrus, if you give me the mic back. Sorry, just in case there was a technical lag there, because I see the red box didn't move to Richard. In case you didn't hear Richard's answer in the very first, the short answer is yes. And if you've got a problem with your battery in your laptop, please get hold of IT and they'll work with you to solve it. So we'll address the single case, but as Richard said, we're trying to do it on an enterprise basis as well. Sheila, how are we doing for time? We're good.
Question 19. What are our plans to celebrate Pride Month this year?
I'll take that. Thank you very much for that question. It's a really important one. Again, as all of you know, and we have spoken about this before, I've spoken about it, Yasmin has spoken about it, Andrew and others, restoring, strengthening, rebuilding relationships with the 2S LGBTQIA+ community is a very important part of the work that we at Canadian Blood Services do. It's not just because we evolved our MSM policy to our now SBBS, sexual behavior-based screening approach, but we know we've always had an important opportunity to make sure we have meaningful relationships with the 2S LGBTQIA+ communities. We have an advisory committee that we work with. We have previously had presences at Pride parades in different parts of the country, and we're seeking to do this in a way that is positive, is meaningful engagement, and is well received by the communities for whom Pride is very important. So yes, we are working to have a presence at a small number of Pride celebrations and festivals this year. We're not going out there in a massive recruitment campaign. We haven't earned, if you want, the trust of the community or the support of the community yet to do that, but we are going there to demonstrate our support for 2S LGBTQIA+ employees, volunteers, partners, donors, would-be donors, and so having a presence there and building the presence over time as part of our overall approach to building and strengthening relationships with those communities is a very important part of the work we will be doing, and we will be doing it guided by our advisory committee and by others. But you will see us have some presence, not at every Pride celebration across the country this year, but at select. And I'm very hopeful that that will build over time until it is much more widespread right across the country. Great question. Sheila.
Will probably be our last one. Question 20. Are there any plans to deploy more devices to sites to support automation efforts? For example, LMS, eCDI, online DSCM, etc.
Maybe I'll just say before, Richard, you answer the specifics. I mean, Jennifer said, you know, we have a lot of decisions at EMT to invest in technology and capabilities and tools to do your work. Richard, how would you like to answer that one?
I think the short answer is yes. We're constantly evaluating and assessing what staff needs to do their work, and we will continue to make those investments in terms of the resources and tools that is required. So absolutely.
Perfect. So Sheila, I think we'll call it there. Maybe I'll begin to close, given it's 5 minutes to the hour. So firstly, I want to thank Richard and Jennifer, particularly Richard, for joining us on his first town hall. Obviously, a lot of questions of interest to all of you, so we will be happy to bring both Richard and Jennifer back in future town halls. We obviously, you could see a dominant theme that we talked about, which is the in-person presence that we're working towards, or the so-called hybrid environment. There will be lots more information provided. You've got the opportunity to provide feedback. There will be more guidance and information provided. You just need to go onto our intranet and get the information there. But I want to close today's town hall, and that's why a question, I think 2 or 3 questions ago, was so pertinent, because for those of you who may not know, in this month, so the end of May, Jean-Paul Bedard, or JP as we call him, our Vice President of Plasma Operations, will be retiring. So I think JP is actually at a meeting out of country today, so I'm not even sure if he's on this call, but I'll speak about him, whether he is or isn't on this call. JP's been with us for about 12 or 13 years. He came with a very, very rich experience from the private sector in the biologics and plasma and pharmaceutical world. So he brought that experience into Canadian Blood Services. Of course, he began his tenure with us as the Vice President of Public Affairs and built a very, very strong foundation there, and then moved to become the Vice President of Plasma Operations in 2018, when we began to dip our toe into the plasma expansion business. And he was perfectly positioned to lead us and make a contribution there. And I think a lot of our successes today, the 11 plasma centers that I talked about at the outset, 7 of which will be operating within the next week or so, and a few more to come in the next 12 months, plus our very, very important landmark agreement with our commercial partner, Grifols, that we've also spoken about before. All of this work evolved under JP's leadership. So his contribution has been immense. He's been a great friend and ally for us at Canadian Blood Services. He has championed our cause in many, many ways, and in some ways quite personal. As you know, he and I and several others from Canadian Blood Services had the opportunity to climb Mount Kilimanjaro together and to summit a physical height, and JP has both done that in the real sense and helped us summit many figurative heights at Canadian Blood Services. So he is a friend, a collaborator, a colleague. He will be sorely missed at Canadian Blood Services. He leaves a great team behind him, and I know that the plasma business will continue to flourish thanks to the foundations that Jean-Paul has built. So JP, whether you're on the call or not, through this call, I will wish you on behalf of the organization bon voyage, enjoy your retirement, enjoy your golfing and your cycling and your hiking and the many other things that give you pleasure and joy. We wish you well, and it's been a great journey together. So folk, I'll close there. I've got a minute or so to go. We obviously didn't get through all the questions. We never do. We always know that there are others. If you've missed some of the questions today, please make sure you connect with us at communications@blood.ca. We always try to get to the questions that we didn't cover and provide other forums in which we can answer them. Again, I would say thanks to you for everything that you do, whether you're a frontline worker or an individual who has been working in a remote environment. We're all part of the same family and we're all here for the same purpose. So thanks for everything that you do. Hopefully summer is coming to you soon, wherever you are in the country. It's been a little slow in some parts of the country. I wish you all well, and we'll talk in a few weeks' time again. Sheila, thanks to you and the team, and take care.